1. A restorative nursing assistant's primary goal is to A. Provide complete personal care to all residents. B. Administer medications as prescribed by the nurse. C. Help residents achieve their highest level of independence in daily activities. D. Document only negative changes in a resident's condition. 2. Which of the following is a core principle of restorative nursing care? A. Encourage dependence on staff for all tasks. B. Focus on a resident's disabilities rather than their abilities. C. Promote self-care and participation in personal routines. D. Limit resident mobility to prevent falls. 3. Before assisting a resident with a restorative exercise, the CNA should first A. Get approval from the resident's family. B. Review the resident's individualized care plan. C. Administer pain medication regardless of need. D. Ensure the resident has just eaten a large meal. 4. Passive range of motion or PROM exercises are performed to A. Build muscle strength in the resident. B. Prevent contractures and improve joint flexibility. C. Increase the resident's endurance for walking. D. Improve fine motor skills for writing. 5. When performing ROM exercises, the CNA should move the joint A. Rapidly and forcefully to achieve full range. B. To the point of slight resistance or pain, then stop. C. Until the resident complains of severe discomfort. D. Only a few degrees to avoid overexertion. 6. Active range of motion or AROM exercises are most appropriate for residents who A. Are completely bedridden and unable to move. B. Have no muscle strength or joint movement. C. Can move their own joints with little or no assistance. D. Require a machine to move their limbs. 7. A common complication of prolonged immobility that restorative care aims to prevent is A. Improved appetite and digestion. B. Decreased risk of respiratory infections. C. Muscle atrophy and weakness. D. Enhanced blood circulation. 8. Encouraging a resident to use adaptive eating utensils is an example of promoting A. Learned helplessness. B. Increased dependence on staff. C. Independence in activities of daily living. D. Social isolation during meals. 9. The individualized care plan for a restorative resident is primarily developed by the A. Resident's family without staff input. B. Dietary department based on food preferences. C. Interdisciplinary team, including the resident and family. D. Housekeeping staff for environmental safety. 10. When assisting a resident with ambulation, the CNA should A. Walk ahead of the resident to clear the path. B. Place the gait belt loosely around the resident's waist. C. Remain close by, providing support with a gait belt as needed. D. Encourage the resident to walk as fast as possible. 11. Splints and braces are often used in restorative care to A. Eliminate all movement in an affected limb. B. Substitute for muscle function permanently. C. Support weak body parts and maintain proper alignment. D. Increase pain and discomfort in joints. 12. To promote bowel regularity in a resident, the restorative CNA should encourage A. Limiting fluid intake throughout the day. B. Consuming only refined grains and low-fiber foods. C. Ignoring the resident's requests for toileting. D. Adequate fluid intake in a diet rich in fiber. 13. Any new or worsening pain experienced by a resident during restorative activities should be reported to the A. Resident's family. B. Charge nurse immediately. C. Activity director. D. Maintenance staff. 14. Proper body mechanics for the CNA when assisting residents prevents A. The resident from moving independently. B. Injuries to the CNA and the resident. C. Quick completion of tasks. D. Communication with the resident. 15. Before transferring a resident from bed to wheelchair, the CNA must ensure A. The bed is in the highest position. B. The resident is wearing soft, non-skid slippers. C. Both the bed and wheelchair brakes are locked. D. The resident has just woken up from a nap. 16. Adaptive equipment is designed to A. Replace the need for any human assistance. B. Make daily tasks more challenging for residents. C. Help residents perform ADLs more independently. D. Be used only by therapists, not CNAs. 17. An example of adaptive equipment that assists with dressing is A. Long-handled shoehorn. B. Regular toothbrush. C. Raised toilet seat. D. Walk-in shower. 18. If a resident refuses to participate in a restorative activity, the CNA should A. Force them to comply, explaining it's for their own good. B. Skip the activity and record it as refused without further action. C. Ask the resident why they are refusing and report it to the nurse. D. Tell the resident they will not receive a treat later. 19. Restorative care is focused on encouraging residents to engage in A. Only passive activities that require no effort. B. Meaningful activities that promote function and well-being. C. Activities that are difficult and frustrating. D. Only group activities with minimal individual attention. 20. What is a key goal of bladder training programs in restorative care? A. To increase the frequency of incontinence. B. To eliminate the need for fluid intake. C. To re-establish a regular pattern of urination. D. To keep the resident awake at night. 21. A contracture is characterized by A. Increased flexibility and range of motion in a joint. B. A permanent shortening of muscle or tissue, causing joint stiffness. C. Swelling and inflammation around a joint. D. Temporary muscle weakness after an injury. 22. A warm-up period before restorative exercises helps to A. Make the resident tired quickly. B. Prepare muscles and joints for activity and prevent injury. C. Cool down the body after strenuous exercise. D. Reduce the overall time spent on exercises. 23. When positioning a wheelchair for a transfer from the bed, it should be placed A. At the foot of the bed, facing away. B. Several feet away from the bed. C. Next to the bed, on the resident's strong side, and locked. D. Behind the CNA for easy access. 24. A resident independently brushing their teeth is demonstrating A. A need for more assistance with personal hygiene. B. A lack of interest in their appearance. C. Increased independence in self-care. D. A desire to rush through morning care. 25. Accurate and timely documentation in restorative care is essential for A. Proving the CNA's efficiency to supervisors. B. Tracking resident progress and adjusting the care plan. C. Sharing personal opinions about the resident. D. Avoiding communication with other team members. 26. ADLs refer to A. Advanced dietary logistics. B. Activities of daily living. C. Assisted device limitations. D. Ambulatory diagnostic labs. 27. When assisting a resident with an ADL, the CNA should A. Do the task completely to save time. B. Provide only verbal instructions without physical help. C. Offer assistance as needed, allowing the resident to do as much as possible. D. Criticize the resident's slow pace or mistakes. 28. Effective communication during restorative care involves A. Speaking only in medical jargon. B. Actively listening to the resident's concerns and preferences. C. Giving commands without explanation. D. Avoiding eye contact to maintain professional distance. 29. The main purpose of a rehabilitation program is to A. Confine residents to their rooms to rest. B. Help residents regain lost function and adapt to new abilities. C. Completely prevent all physical activity. D. Increase a resident's reliance on caregivers. 30. Maintaining a positive and encouraging attitude by the restorative CNA can A. Make the job more difficult. B. Show authority over the resident. C. Significantly boost resident motivation and participation. D. Distract the resident from their goals. 31. A resident participating in a walking program should always wear A. Loose, ill-fitting clothing. B. Slippers with no traction. C. Bare feet for better ground feel. D. Well-fitting, supportive, non-skid footwear. 32. If a resident begins to fall during ambulation, the CNA should A. Attempt to stop the fall completely by lifting them. B. Yell for help and leave the resident. C. Guide the resident safely to the floor, protecting their head. D. Blame the resident for being unsteady. 33. To prevent falls, the restorative CNA should ensure A. Call lights are placed far from the resident's reach. B. Residents are encouraged to rush to the bathroom. C. Pathways are clear of clutter and adequately lit. D. All assistive devices are removed from the room. 34. Allowing a resident to choose their meal options, when appropriate, promotes A. Confusion and indecision. B. Their independence and sense of control. C. Noncompliance with dietary restrictions. D. Increased staff workload for ordering. 35. The restorative care team typically includes, but is not limited to A. Only the resident and their primary physician. B. Nurses, CNAs, and housekeeping staff. C. Physicians, nurses, therapists or PT, OT, ST, and CNAs. D. Only the resident's family and social worker. 36. Providing privacy during personal care tasks is important too. A. Hide what is being done from other staff. B. Maintain the resident's dignity and respect. C. Speed up the completion of the task. D. Avoid distractions from outside the room. 37. Consistency in restorative care routines is crucial for A. Making the resident bored with the same routine. B. Allowing for flexibility and changes in care. C. Reinforcing new skills and building successful habits. D. Confusing the resident about their daily schedule. 38. For a resident with dysphagia or difficulty swallowing, a common restorative goal might be to A. Encourage them to eat only solid, dry foods. B. Safely consume foods and liquids of appropriate consistency. C. Restrict all oral intake to prevent aspiration. D. Increase their weight rapidly without concern for safety. 39. Oral hygiene is a vital part of restorative care because it A. Is only for cosmetic appearance. B. Prevents infections and promotes overall health. C. Has no impact on general well-being. D. Is solely the responsibility of the family. 40. When assisting with feeding, the restorative CNA should A. Rush the resident to finish quickly. B. Offer very large spoonfuls of food. C. Sit at eye level and offer small, manageable bites. D. Leave the resident unattended to eat. 41. Hand-over-hand assistance is a technique where the CNA A. Performs the entire task for the resident. B. Provides verbal cues without physical contact. C. Guides the resident's hand over theirs to help with movement. D. Uses a mechanical device to complete the task. 42. Restorative care for a resident with a vision impairment might include A. Frequently rearranging furniture to keep them alert. B. Keeping the environment consistent and well lit. C. Speaking loudly at all times to compensate. D. Limiting their mobility to prevent accidents. 43. Encouraging reminiscence and life review in residents can help to improve A. Their physical strength and endurance. B. Their ability to eat more food. C. Cognitive function and emotional well-being. D. Their need for assistance with ADLs. 44. The primary goal of bladder training is to A. Increase instances of urinary incontinence. B. Re-establish a regular pattern of urination and continence. C. Eliminate the need for any fluid intake. D. Keep the resident awake at night to use the restroom. 45. When assisting with dressing, the CNA should encourage the resident to A. Wear only hospital gowns for ease of care. B. Choose their own clothing if appropriate. C. Wait for staff to dress them completely. D. Dress in the dark to improve tactile sensation. 46. A transfer board is most commonly used for residents who A. Are completely independent in transfers. B. Require a full mechanical lift for all transfers. C. Have some upper body strength but cannot stand to transfer. D. Prefer to stand and pivot without assistance. 47. Restorative care often involves educating residents and their families about A. The latest gossip within the facility. B. How to avoid all physical activity. C. Techniques and strategies for maintaining independence at home. D. Only the negative aspects of aging. 48. A restorative goal for a resident recovering from a stroke might be to A. Avoid all movement on the affected side. B. Regain strength and coordination on the affected side. C. Focus only on cognitive games and puzzles. D. Sleep for extended periods to promote healing. 49. If a resident experiences a setback in their restorative progress, the CNA should A. Give up on the resident and stop all restorative efforts. B. Document the setback and report it to the nurse for reassessment. C. Blame the resident for not trying hard enough. D. Ignore the setback and continue with the original plan. 50. The restorative CNA's observations are crucial for A. Entertaining the resident with anecdotes. B. Assessing the resident's progress and adjusting the care plan. C. Proving the CNA's superiority over other staff. D. Criticizing other team members' efforts. 51. Maintaining skin integrity is a key aspect of restorative care, especially for residents with A. Excellent mobility and healthy skin. B. Excessive sweating and oily skin. C. Limited mobility or incontinence. D. Naturally good circulation. 52. The term adaptive devices primarily refers to A. Specific types of medications. B. Tools that help individuals perform tasks more easily. C. Specialized hospital beds. D. Recreational activities for residents. 53. Encouraging weight-bearing activities can help prevent A. Increased muscle strength. B. Improved joint flexibility. C. Bone density loss or osteoporosis. D. Enhanced balance. 54. Good posture in restorative care is important because it A. Makes the resident appear taller and more imposing. B. Limits lung capacity and digestion. C. Promotes proper body alignment and prevents muscle strain. D. Makes sitting and standing more uncomfortable. 55. When a resident uses a cane, the CNA should ensure A. The cane is held on the resident's weaker side. B. The cane is held on the resident's stronger side. C. The cane is too short for the resident's height. D. The resident swings the cane widely with each step. 56. Encouraging social interaction and participation in group activities can significantly improve a resident's A. Physical pain level. B. Appetite only. C. Mental and emotional well-being. D. Sleep patterns only. 57. The restorative CNA should always promote a resident's independence, even if it means A. It takes significantly longer to complete a task. B. The CNA has to do more work than necessary. C. The resident becomes frustrated and gives up easily. D. The resident will always need minimal assistance. 58. The role of positive reinforcement in restorative care is to A. Make the resident feel guilty for slow progress. B. Motivate and encourage the resident's efforts. C. Offer false praise to boost morale temporarily. D. Compare the resident's progress to others. 59. When assisting a resident with a feeding tube, the restorative CNA should ensure the resident is A. In a completely flat, supine position. B. Able to self-administer medications. C. In an upright or semi-Fowler's position to prevent aspiration. D. Regularly engaging in oral intake only. 60. The purpose of a bowel program in restorative care is to A. Increase instances of constipation. B. Establish a regular pattern of bowel elimination. C. Limit the resident's privacy during toileting. D. Rely solely on laxatives for bowel movements. 61. How does adequate hydration impact restorative care? A. It has no significant effect on overall well-being. B. It can lead to increased dehydration and kidney problems. C. It helps prevent constipation, UTIs, and promotes overall health. D. It causes rapid weight gain in residents. 62. When assisting a resident with personal hygiene, the CNA should encourage them to A. Let the CNA do everything to save time. B. Perform as much as they can independently. C. Hurry through the process without thoroughness. D. Skip hygiene altogether if they are tired. 63. The use of a commode can be beneficial for residents who have difficulty. A. Sleeping through the night. B. Reaching the toilet in the bathroom due to mobility issues. C. Eating solid foods. D. Remembering recent events. 64. Restorative care principles apply to residents with A. Only short-term conditions and full recovery expected. B. Only physical limitations requiring ambulation training. C. A wide range of physical and cognitive limitations. D. Only cognitive impairments requiring memory exercises. 65. Incorporating a resident's personal preferences into their restorative care plan promotes A. Confusion and noncompliance. B. A slower pace of care. C. Cooperation, motivation, and individualized care. D. Conflict among the care team. 66. A gait belt is primarily used for A. Holding up a resident's pants during ambulation. B. Providing a secure grip for the CNA during transfers and ambulation. C. Decorating a resident's clothing. D. Restraining a resident who is agitated. 67. When a resident is participating in a strengthening program, the CNA should A. Encourage them to lift very heavy weights beyond their capacity. B. Tell them they are too weak to make progress. C. Follow the care plan for specific resistance and repetitions. D. Allow them to stop whenever they feel slight discomfort. 68. Cognitive restorative activities commonly include A. Watching television for extended periods. B. Running marathons or other strenuous physical tasks. C. Puzzles, memory games, and engaging discussions. D. Sleeping excessively throughout the day. 69. The restorative CNA should immediately report any new signs of skin breakdown, such as redness or open areas, to the A. Resident's family, B. Dietary staff, C. Activity director, D. Charge nurse. 70. The goal of occupational therapy in restorative care is to A. Administer injections and medications, B. Help residents regain skills needed for daily living activities, C. Diagnose underlying medical conditions, D. Provide deep tissue massages. 71. When encouraging communication for residents with speech difficulties, the CNA might use A. Ignoring their attempts to speak, B. Communication boards or gestures, C. Shouting loudly to be heard, D. Completing their sentences for them. 72. Restorative care aims to improve a resident's quality of life by A. Restricting their activities and social interactions, B. Maximizing their functional abilities and independence, C. Isolating them from group activities, D. Forcing them into unwanted activities. 73. The purpose of regular repositioning for a bed-bound resident is to A. Make them more uncomfortable and restless, B. Encourage deep sleep for extended periods, C. Prevent pressure ulcers and promote circulation, D. Change their clothing more frequently. 74. When assisting a resident with feeding, the CNA should ensure the resident is in A. Reclined position to relax, B. Upright position to prevent aspiration, C. Sideline position for easy access, D. Slumped position to conserve energy. 75. The restorative CNA plays a crucial role in maintaining a residence. A. Financial records and investments, B. Political opinions and affiliations, C. Functional abilities and overall well-being, D. Personal social security number. 76. Why is it important to encourage residents to participate in their own care planning? A. It wastes time and complicates the process. B. It promotes autonomy and makes the care plan more effective. C. It leads to conflict among the care team. D. It is not important for the resident's recovery. 77. A common restorative goal for a resident with a cognitive impairment might be to A. Learn a new, complex language, B. Memorize entire books daily, C. Maintain existing cognitive abilities and engage in stimulating activities, D. Avoid all mental effort to prevent fatigue. 78. The restorative CNA should always be aware of a resident's A. Favorite television shows, B. Shoe size, C. Past employment history, D. Pain level and any signs of discomfort. 79. The term rehabilitation most accurately refers to A. The process of curing a terminal disease, B. A social club for retired individuals, C. The process of restoring an individual to their highest possible level of function, D. A type of medication for chronic pain. 80. When assisting a resident with a bowel program, the CNA should A. Ignore their need for privacy, B. Follow the care plan for timing and assistance, C. Encourage them to hold their bowel movement, D. Offer only clear liquids immediately before. 81. Restorative care often involves the use of A. Physical restraints to limit movement. B. Heavy sedatives to promote rest. C. Assistive devices and therapeutic exercises. D. Isolation techniques for difficult residents. 82. The primary purpose of speech therapy in restorative care is to help residents with A. Walking and balance. B. Communication and swallowing difficulties. C. Dressing themselves independently. D. Managing their personal finances. 83. When encouraging a resident to walk, the CNA should provide A. Excessive help, even if not needed. B. Just enough assistance to ensure safety and promote independence. C. No assistance at all, encouraging full independence immediately. D. Criticism for slow progress or unsteady gait. 84. The restorative CNA should be familiar with the signs and symptoms of A. Upcoming holidays and celebrations. B. Depression and anxiety in residents. C. Local lottery winning numbers. D. Popular new television shows. 85. Maintaining adequate nutrition is essential for restorative care because it A. Makes residents gain excessive weight rapidly. B. Provides energy for activities and supports healing. C. Only affects taste preferences. D. Has no significant impact on physical recovery. 86. When a resident refuses to eat, the restorative CNA should A. Force feed them to ensure calorie intake. B. Offer alternatives and report the refusal to the nurse. C. Ignore their refusal and clear the tray. D. Tell them they will not receive dessert later. 87. The restorative CNA's role in wound care is to A. Change complex wound dressings. B. Observe and report any changes in wound appearance. C. Diagnose wound infections. D. Prescribe antibiotics for wound healing. 88. Encouraging regular sleep patterns can positively impact a resident's A. Physical energy and cognitive function. B. Desire to argue and complain. C. Need for stimulating activities. D. Ability to remain awake all night. 89. The term ambulation aid refers to A. A specific type of medication. B. A device that helps a resident walk, such as a walker or cane. C. A type of blanket used for warmth. D. A specialized hospital bed. 90. The restorative CNA should demonstrate patience and understanding when a resident is learning new skills because A. It is a sign of laziness on the resident's part. B. Learning new skills takes time and effort, especially with limitations. C. It will speed up the learning process. D. It shows weakness on the part of the CNA. 91. The purpose of therapeutic activities in restorative care is to A. Keep residents busy with unproductive tasks. B. Replace all medical treatment and medications. C. Encourage isolation and quiet time. D. Promote physical, cognitive, and social well-being. 92. When assisting a resident with a shower, the CNA should encourage them to A. Sit down and let the CNA do everything. B. Stand for the entire duration if possible and safe. C. Hurry through the process to save time. D. Avoid washing certain areas of their body. 93. Restorative care is a continuous process that involves A. Only short-term goals with a defined endpoint. B. Stopping once initial goals are met. C. Ongoing assessment, planning, intervention, and evaluation. D. Only one type of specialized therapy. 94. The restorative CNA should always ensure the resident's safety during exercises by A. Ignoring call bells during the activity. B. Providing appropriate supervision and assistance. C. Leaving them alone to encourage independence. D. Encouraging risky behaviors to challenge them. 95. Encouraging proper breathing techniques can help residents with A. Swallowing difficulties. B. Lung capacity and respiratory health. C. Muscle spasms. D. Joint pain in the extremities. 96. The restorative CNA's observations about a resident's mood and behavior are important for A. Gossip purposes among staff. B. Identifying potential psychological or emotional needs. C. Predicting the weather for the next day. D. Deciding on the next meal menu. 97. The significance of documenting a resident's refusal of care is that it A. Is not important and can be ignored. B. Means the CNA failed in their duty. C. Informs the healthcare team and protects the CNA legally. D. Is a sign of disrespect from the resident. 98. The restorative CNA should understand that residents have the right to A. Be forced into care they do not want. B. Never be consulted about their care plan. C. Be ignored if they are uncooperative. D. Make decisions about their own care, even if different from staff's recommendations. 99. The restorative CNA's role in promoting sleep for residents might include A. Encouraging napping throughout the day. B. Ensuring a quiet, comfortable, and dark environment at night. C. Providing caffeinated beverages before bedtime. D. Keeping the lights on all night for safety. 100. When assisting a resident with personal grooming, the CNA should A. Do everything for them to ensure a neat appearance. B. Tell them they look bad if they don't participate. C. Rush through the task to finish quickly. D. Encourage them to participate as much as possible. 110. The restorative CNA's documentation should be A. Vague and infrequent. B. Accurate, objective, and timely. C. Full of personal opinions and judgments. D. Written in code only understood by few. 102. The purpose of a mobility assessment is to A. Determine what furniture to purchase for the facility. B. Evaluate a resident's ability to move and identify areas for improvement. C. Decide where the resident should live after discharge. D. Find out their preferred mode of transportation. 103. When assisting a resident with a transfer, the CNA should give clear, concise instructions to A. Confuse the resident about the steps. B. Guide the resident through the steps safely and effectively. C. Speed up the transfer without resident input. D. Impress onlookers with their efficiency. 104. Restorative care emphasizes the importance of a residence. A. Past mistakes and limitations only. B. Remaining abilities and potential for improvement. C. Dependence on others for all needs. D. Social isolation from peers. 105. The restorative CNA should encourage a resident to participate in their care by A. Demanding compliance and obedience. B. Offering choices and explaining the purpose of activities. C. Threatening consequences for non-participation. D. Ignoring their input and doing tasks for them. 106. The goal of a residence exercise program is to A. Make them exhausted and tired. B. Maintain or improve physical strength, flexibility, and endurance. C. Increase their pain and discomfort. D. Keep them confined to bed for safety. 107. When assisting a resident with a dressing change, the CNA should A. Leave the room quickly once the nurse is done. B. Observe the wound and report any abnormalities to the nurse. C. Apply whatever dressing is available without checking. D. Discuss the wound details with other residents. 108. The restorative CNA should be familiar with the use of A. Complex medical machinery. B. Common assistive devices like walkers, canes, and reachers. C. Surgical instruments. D. Highly specialized rehabilitation equipment requiring certification. 109. Encouraging a resident to engage in hobbies and interests can promote A. Boredom and disinterest. B. Cognitive stimulation and emotional well-being. C. Physical fatigue only. D. Increased social isolation. 110. The restorative CNA's documentation should be A. Vague and infrequent. B. Accurate, objective, and timely. C. Full of personal opinions and judgments. D. Written in code only understood by few. Restorative CNA. The Restorative CNA or Certified Nursing Assistant test evaluates a CNA's knowledge and skills in supporting residents' functional independence and quality of life through restorative care practices. This includes promoting mobility, maintaining range of motion, assisting with ambulation, and encouraging self-care in daily activities. The test focuses on techniques that prevent complications from immobility, such as pressure sores and contractures, while also assessing the CNA's ability to work collaboratively with rehabilitation staff. It covers topics like body mechanics, assistive devices, patient motivation, documentation, and individualized care plans. The goal is to ensure CNAs can effectively implement restorative programs that align with residents' goals and clinical needs. Here are the top 5 beneficial uses of restorative CNA exam. The restorative CNA exam ensures that CNAs are equipped to support residents in regaining or maintaining independence, leading to better mobility, reduced complications, and enhanced quality of life. 2. Strengthens CNA skills. It validates the CNA's competence in restorative techniques, such as proper body mechanics, range of motion exercises, and safe ambulation, increasing their value within the healthcare team. 3. Career advancement. Passing the exam demonstrates a CNA's specialization in restorative care, opening doors to more advanced roles, increased responsibilities, and better employment opportunities in rehabilitation and long-term care settings. 4. Promotes team collaboration. Certified restorative CNAs work closely with physical therapists and nurses, improving interdisciplinary care and communication. 5. Supports regulatory compliance. Having certified restorative CNAs helps facilities meet care standards and documentation requirements, contributing to higher inspection scores and accreditation success.